My name is Dr. Mazda Turel, and I'm a neurosurgeon at the Wockhardt group of hospitals in Mumbai Central. Today, we're going to address a few questions about the important condition called spinal stenosis.
What is spinal stenosis and how does it affect the spine?
Spinal stenosis is a condition in which there is narrowing of the spinal canal. Stenosis means narrowing or compression of the spinal canal, which causes compression of the nerves in the spinal canal, which sometimes results in pain, numbness, tingling, and if it becomes severe, can even cause a significant weakness of the legs. Sometimes this can even lead to problems with bowel and bladder function and needs to be addressed adequately.
Who is most at risk for developing spinal stenosis?
Spinal stenosis most often is a degenerative condition, and hence the elderly are mostly at risk of developing spinal stenosis. However, sometimes you can have spinal stenosis due to a large disc prolapse or due to certain injuries of the spinal canal, and that can happen even in youngsters. So, any condition that narrows the spinal canal, whether it's degenerative or traumatic, or let's say it's a slip disc, can result in significant spinal stenosis.
What are the non-surgical treatment options available for spinal stenosis?
Spinal stenosis can be attempted to be alleviated with a combination of physical therapy and medication. Good physiotherapy may to some extent alleviate spinal stenosis, especially spinal extension exercises. Sometimes medication in the form of neuropathic drugs can help relieve the pain of spinal stenosis. Oftentimes injections along with anti-inflammatory medication can also help spinal stenosis medically. However, at some point in time, if physiotherapy and medicine do not help, then surgical decompression of the stenosis seems to be a reasonable option to consider.
What are the long-term outlook and quality of life for someone with spinal stenosis?
So, spinal stenosis significantly impairs quality of life by causing back pain, leg pain, causing neurogenic claudication, tingling and numbness in the legs, paresthesia, and inability to walk for long distances. Alleviating this pain either medically or surgically can result in a significant improvement in quality of life, and patients are alleviated of their pain and can eventually walk much longer distances once their spinal stenosis is relieved.
Does spinal stenosis always lead to paralysis if left untreated?
Not always, and paralysis is quite a harsh term, but yes, spinal stenosis can cause debilitating weakness of the legs, which can eventually leave you in a bed-bound condition if not adequately treated and very severe. However, mild spinal stenosis can be substantially and adequately managed with medication and physiotherapy.
Can genetics or injuries also contribute to spinal stenosis, or is it purely age related?
No, of course, genetics is a strong contributing factor. If you have a congenitally narrow canal in certain conditions, then you have a higher likelihood of developing spinal stenosis as opposed to somebody who doesn't have a very narrow canal. But age is also another predisposing factor, and of course, if you develop other forms, other pathologies, or other injuries that can narrow the spinal canal, those can also lead to spinal stenosis.
Last question. Is spinal stenosis caused solely by poor posture or lifestyle habits?
So, spinal stenosis is not solely caused by poor posture, but poor posture and lifestyle can lead to aggravation of spinal stenosis. If the muscles of the spine are not adequately strengthened, if the core is not adequately strengthened, it can lead to aggravation in the spinal stenosis because the body slouches and slumps and that can cause worsening of symptoms related to spinal stenosis.
Yes.